All right, welcome to another edition of Medicine Mondays. I am yours truly, Dr. Pierre, your favorite board certified internist, host of the Medicine Mondays, as well as Empower Yourself for Better Health series. Of course, Dr. Pierre's health checks on my other YouTube channel as well. Make sure you are subscribed to that. I'll throw a link, to the side of me as well, just to make sure you follow up on that. But today we're talking, especially if you happen to catch my live stream on Friday, we are going to be talking about the Johnson & Johnson vaccine. More importantly, why did the FDA, as well the CDC, say, you know what, let's hold on for a second and let's pause all administration until we find out what's going on, especially here in the United States. So again, you're truly Dr. Barry. So let's talk about it, right? So we're talking about the Johnson & Johnson vaccine. We're talking about the most recent decision by the FDA, which happened on the 13th of April, to say, you know what, let's hold off on continuing to give these medications until we find out what is going on. And what is going on is what we know now is that we have at least 6 people, actually women, from the ages of 18 to 48, who developed this rare combination of a blood clotting disorder, the cerebral venous thrombosis, between days 6 to 13, as well as some associated thrombocytopenia. And for those who may not know, thrombocytopenia is our platelet count, and is when our platelet count is low. And our platelets do a great, phenomenal job, especially when we think about, stopping. Like if you cut yourself, right, your platelets are what helps you stop bleeding, which is why medications like aspirin and Plavix, they typically will work on the platelets to try to prevent them from doing their job. And that's why aspirin and Plavix typically works for heart disease patients or stroke patients. That's why we typically give that medication. So, first thing first. So we have, this decision. Again, we have 6 women. And again, just for, us to kind of get a broad view of what's going on, at least at the time, of recording, we have given out 6.8 million doses of the Johnson & Johnson vaccine. And we have 6 people who have contracted this combination of disorders. And right now it is, if you ask me, I think it's very early to talk about causation. But what I do love, and I've gotten this question a lot over this past few days, is, hey, Dr. Barry, what do you think about the recent decision, right? And of course, we're definitely going to talk about, my personal thoughts. We'll definitely hold that off to the end. But what do you think about the recent decision? And again, I think it's a good one, right? And like I said, I'll delve into it more later on. So, first thing first, let's talk about it. Again, the CDC, FDA kind of met. They said, you know what, even though 6 cases, are a small number, it's significant enough for us to say, let's take a look. And I think they're being very cautious, especially when we think about AstraZeneca, which is another vaccine candidate that's not available here in the United States. It is available in other countries, outside the United States, but it's not available here in the United States because of concern that, that may be associated with blood clots as well. And interestingly enough, both the Johnson & Johnson as well as AstraZeneca, they're actually the same type of vaccines, right? These we would call these adenovirus vaccines, which again is not a new type of vaccine. We've been making these for decades now, right? So so people don't be concerned from that standpoint there. But because of, I think what we're seeing with the AstraZeneca, and where AstraZeneca being paused at certain places because of blood clotting, I think the United States really wanted to jump ahead and say, all right, before we even go in this direction, let me make sure that this isn't something, we need to be concerned about here with the Johnson & Johnson. So they're getting, as we speak, they're collecting data to kind of see if there's, a way to kind of correlate the causation. Because like I said, 18 to 48 is a pretty wide range. 6 days to 13 days, pretty wide range, right? And when we think about trying to piece together some type of relationship, and it's interesting, like I was doing the math, right, on what type of percentage that is, right? So like I think first and foremost we should talk about what is like this rare blood clotting disorder, which is cerebral venous thrombosis, which again I'm pretty sure in the past 5 days, which has been Googled more than it's ever been Googled, for the past like decade or so. Like, again, I remember having to read up on it, when I was a medical student, even medical resident, especially when I was doing my neurology rotations, because that was one of the That's one of the questions that you always start thinking about, because it is missed. It is one of those things where, you typically have to do a battery of tests and then kind of rule out the other things before you start thinking about, like, I wonder if they have, this venous thrombosis of the cerebrals, right? So what is cerebral venous thrombosis? Again, we are going to be leaning on the Johns Hopkins Medicine definition, right? So again, I'll be sharing my screen just so you can kind of get an idea. Like I said, again, all of these links will definitely be in the show notes as well. So it is described as cerebral venous sinus thrombosis occurs when a blood clot forms in the brain's venous sinuses. This prevents blood from draining out of the brain, and as a result, blood cells may break and leak blood into the brain tissues, forming a hemorrhage. Right. So again, this is a different cause for a hemorrhagic stroke, right, which is essentially a stroke due to bleeding in the brain. There's a lot of again, we're not going to talk about strokes on this one, but again, it's one of the type hemorrhagic strokes are one of the type of strokes that occur often. And again, this is what we call the differential of causes for it. And again, it talks about this chain of events is a part of a stroke that can occur in adults and in children. Even occurs in newborns and babies in the womb. A stroke can damage the brain, the central nervous system. A stroke is serious. It requires immediate medical attention, right? So this is, again, Hopkins medicine, like making sure, like, hey, like, I know you're reading, about cerebral venous thrombosis, but if you got any of these symptoms, please go to the hospital, right? And we're going to talk about what are the signs and symptoms that people should be concerned about when we think about this venous thrombosis, and why, especially because I've fielded plenty of calls from my friends and family members who have gotten the Johnson & Johnson, and they ask, like, hey, like, is this something I need to worry about? And again, like I said, I think it's very early for us to be able to say, like, yeah, the vaccine is the cause. But again, we're being very overly cautious, which I think we need to be, especially in this time of age, to make sure that we don't go down that route. So let's talk about some of the causes for this cerebral venous thrombosis. And some of them are, we may know being a woman, right, puts you at an increased risk for this type of disorder. If you're on birth control, if you're pregnant, again, some other risk factors associated with it, iron deficiency, dehydration. There's actually some blood clotting disorders. So if you already have a propensity to have a blood clotting disorder, you are at an increased risk for this type of disorder occurring in the brain as well too. So again, we're just kind of more focusing on the adults aspect of it. Cancer, obesity can play a factor as well too. And again, I talked about some of those blood clotting disorders like protein C, protein S deficiency, lupus anticoagulant, factor V latent mutation, antiphospholipid syndrome. Again, these are a lot of these autoimmune related disorders that increase your risk for having blood clots in general. And if they increase your risk of having blood clots in general, again, the cerebral venous thrombosis is kind of right up there. So let's talk about the numbers, right? Because I think that's more important. Again, 6 out of 6.8, that's not that many. That's really like less than 1 per every million. Now, for a patient who has not gotten the Johnson & Johnson vaccine, your risk of getting this disorder usually occurs about 2 to 5, depending on what you read, out of every million, right? So as already we can see that you have a higher chance of getting this disorder not getting the vaccine than you are getting the vaccine, right? So again, and this is why you have some proponents who are like, maybe we're being a little bit too cautious because I don't see the correlation, which is understandable. But again, we have to be very diligent in what we're trying to do, because again, everything's about safety for everyone out there from that standpoint there. So like symptoms, right? What are the signs and symptoms that you should be worried about, or you should be really concerned about, just in case you may be dealing with this, right? So the biggest one, which occurs about 70 to 90% of patients, is headaches. And these are like not just like your regular tension headaches. These are piercing headaches, worst headache you've ever felt in your life. Those are the type of headaches that really should be concerned about. And again, remember, the time frame that we're seeing here is 6 to 13 days, right? So that's within a week to 2 weeks. If you get that type of headache, should be concerned. blurred vision as well, some fainting, some weakness, some muscle weakness as well, even more severe, like seizure-like activity, stroke-like activity. Again, obviously, if you're having any of these, you should be running to the hospital anyways. That's definitely not a let me call my doctor to see what my doctor thinks about it if I'm having seizure-like activity. Like, no, you go to the nearest hospital and you run over there in that regard. So those are some of like the big signs and symptoms associated with this disorder. And reason why we need to know that is because you, as a healthcare professional, right? Again, as one who is here, who is a proponent of the vaccine, one who, again, not only have I gotten the vaccine, my wife's gotten the vaccine, my mom's gotten the vaccine, right? Everyone who is eligible around me, I'm telling them get the vaccine, right? Like, I have to be able to educate the community as well too, especially when they hear some news like this, right? So, like, and I want you guys to be educated, especially when you're watching this channel here or you listen to me on the podcast or wherever you may be kind of consuming my content. Like, I want you guys to be so empowered that you can make your own well-informed decisions. So if this informed decision says, yeah, I don't want to do vaccine, that's cool, right? But as long as it's an informed decision and you know all of the risks and benefits that are going into that informed decision, I'm okay with that, right? Again, when we empower yourself for better health, that doesn't mean you have to do everything Dr. Pierre does, right? Or Dr. Pierre says. It just means that you have to be empowered with the correct knowledge. And I will stress correct knowledge because, unfortunately, when this news came out, you should have seen all of the people who already weren't getting the vaccine anyways, right? They had zero intention of getting the vaccine, saying like, oh, I knew it, acting as if this, and let's just break out the numbers, right, from a percentage standpoint of the likelihood of you getting this process, right? So 6 divided by 6.8 million. Let's see what those numbers tell us. You have a 0.00000088 chance of getting this disorder, right? So again, like, you have a more likely chance to get struck by lightning, right, walking outside, right, like, than you do getting this disorder. And more importantly, and I think this is what we need to stress, like, you heard all of the zeros I mentioned on there. You have a 20% chance of getting a blood clot type disorder if you get COVID. 20, right? Again, I mentioned a whole bunch of zeros on if you get this vaccine. Getting COVID-19, you have a 1 in 5, 20% chance of picking up a blood clot, right? So again, it's not, this is not an apples and oranges things. Getting COVID-19 puts you at a much higher and increased risk chance of getting a blood clot than picking up this vaccine. It just is what it is, right? Like, there's really no argument there. There's no back and forth that's needed. Those are just absolute facts, right? And that's what we need. That's what we're here to focus on, the absolute facts of it all. Because at when the decision comes out, right, which I fully suspect probably within the next couple of weeks, that the FDA and CDC says, hey, you know what? We're not seeing any correlation associated, with this vaccine. We can go ahead and give it out. Like, I don't want people to be shocked or surprised, right? Because I don't expect them to find some new revelation that says like, oh yes, it's definitely a problem that we need to be concerned about. I just don't see it happening in that regard. So we just have to be very diligent with the news information that we're getting. But more importantly, we just want to be educated, right? So again, we talked about the signs and symptoms that I want people to be aware, right? Again, especially if you're one of my followers or listeners here, understand if you're a woman, you're at a higher increased risk for this type of disorder anyways, right? So if you've gotten the Johnson, so this is for, the people who've gotten the Johnson vaccine, right? Because that's the question I've gotten. Like, hey, if I've gotten the Johnson vaccine, like, should I be concerned? And it's a very valid question. Should you be concerned? I think if you've gone 3 weeks since you've gotten that vaccine, the likelihood of getting this rare disorder is extremely low. Like, we just have not seen it. We're talking about Johnson & Johnson vaccine because we've had no reported cases with the Moderna and Pfizer, which again is a different type of vaccine. That's the mRNA vaccines. And we've had different long discussions here on Medicine Mondays about the different issues associated or concerns, I should say, associated with mRNA vaccines. So again, the Johnson & Johnson is a different type of vaccine. The AstraZeneca is a different type of vaccine. So we're just being very diligent just to make sure that this isn't something that we're going to have to be worried about, especially in the future. So if you've gotten the Johnson & Johnson vaccine, listen up. If you're 3 weeks out, very low risk, right? But let's say you're within that sweet spot, that 1 week to 2 weeks. Let's say you're a woman, right? Let's say you're 18 to 48, right? So the things that you want to think about, again, these are all about the symptoms, right? And again, listen to your body, right? Piercing headaches, right? Weakness, blurry vision, double vision. Let's say you're having some gait issues, right? Like you're not walking correctly or your balance isn't there, right? All of these neurological related issues should prompt you to say, you know what? Let me go to the doctor, urgent care, ER. Let me go somewhere just to get checked out, just to make sure. I don't want you flooding the emergency rooms because your tension headache and you think that's what it is, right? Now again, they're gonna check you, right? They're gonna check you for the cerebral venous thrombosis, but like I don't want you guys to be surprised when you don't realize you don't have it, right? There's a lot of different sequelae associated with it. So if you ask me, hey, Dr. Barry, like I haven't gotten my vaccine yet. I was scheduled to get it next week, right? And let's say by next week it opens up. I was scheduled to get it next week. What should I do? I'm gonna tell you, go ahead and get the vaccine because I know the risk of getting COVID-19 is still higher than the risk of you getting this disorder. I know the risk of you getting COVID-19 and getting a blood clot is still higher than getting this disorder. And again, we're not saying that the vaccines are going to protect you from picking up COVID-19. Remember, COVID-19 is here to stay, right? We already having reports of them talking about maybe we're going to need a booster in a year or so, which again, as long as you've been following me, you know we've said that like in January. We already said that in December, January. Like, don't be surprised when they say we need boosters. We've already said that, especially with all of these variants coming around here. Like last time I checked, we have about 8 different variants across the United States. And again, as no telling what's across the country, but at least here in the United States, we have like 8 different variants of COVID-19. Which again, we're not afraid of variants. We expect variants to occur, especially when we think about viruses, especially when we think about viruses that spread to as many people as it has spread. Again, worldwide, 140 million people, right, have contracted COVID-19, right? So when you got a virus that spreads that much, you're gonna have some variants. So I'm gonna tell you again, if that was me, right, if I hadn't gotten vaccinated, and my only option was to get your Johnson & Johnson, I'm getting that Johnson & Johnson vaccine because I know the risk associated with getting COVID-19 unvaccinated is far worse than the risk of getting COVID-19 and getting the vaccine and maybe picking up this rare disorder. Again, like I said, the chance of you getting it is so extremely small, right, that I'm confident as a healthcare professional that I would weigh that pros and cons. Again, everything's a risk and reward type thing, and I think the risk of getting COVID-19 as an unvaccinated person and then having to see a person like me in the hospital is much higher than the risk of you getting the vaccine and picking up this rare disorder, right? So again, and because obviously because I got that question a lot. Like it was like a twofold question, like, hey, Dr. Barry, what should I do now? What should I be worried about? So again, educate yourself, right? Again, don't just listen to me. Like I said, I'm gonna have the information in the show notes, but read up on your own, right? Educate yourself on what cerebral venous thrombosis is. Educate yourself on what thrombocytopenia is, and what are some of the signs and symptoms, especially when we think about thrombocytopenia. A lot of times it's easy bruising. Sometimes you see this almost like I don't want to say spider bites, but like almost like little dots around your hands and sometimes your face and sometimes your skin, especially with blood vessels breaking off, which occur in thrombocytopenia. So again, something to think about, something to kind of keep an eye on. But at the end of the day, I'm still telling you to get that vaccine, whichever vaccine it is, even if it is Johnson & Johnson. So again, we will kind of be following along the news, of course. Again, the second we get any news update, I'll make sure I hop on here to give you another update as well, to just make sure everyone's informed. So you guys be blessed. Make sure if you're one of my podcast listeners, make sure you're subscribed to the podcast. If you're one of my YouTube watchers, make sure you like, subscribe, hit us with a comment, right? We love the comments. And make sure you're also following my Dr. Pierre's Health Checks YouTube channel as well too, because we're getting a lot of traction on that side as well too. And again, that's where I answer, like if you got questions, hit your questions in the comments, right? And I'll throw up a quick little 1-minute video. Again, all the videos on the Dr. Pierre's Health Checks side is just 1 minute or less. So I'll answer your question quick, fast, and kind of keep it moving. So you guys be blessed. Have a great day, and I'm gonna see you guys next week.